One of the things that I know you or I really enjoy talking much about is healthcare. But it is on the tip of everybody's mind.
It is on the tip of everybody's mind, and
you gave me some clarity.
Right. Well, we did talk briefly before we started this particular interview, and I was telling you that my area of interest was never in healthcare, but I was kind of thrust into that position of learning about it because I was on the Human Services, the Ways and Means Committee for all the human services issues that are going on around the state. Mm-hmm. And we have a bill that came out, and I know a lot of people are really upset about it. In fact, there are two different bills that came out.
And that's what I didn't understand.
Yeah, and I think a lot of people are confusing them. One had to do with community care organizations, and one had to do with the health insurance exchange. And I hear from people, and they may be right in some respects, that there are elements of Obamacare in the community care organizations. But that goes back to 40 years when we were mandated to have a Medicaid program. Mm-hmm. Medicaid is the state-managed, mm-hmm. state-provided services. And for every dollar that we spend on folks, low-income people, 60% of that comes from the federal government. So
we're talking about the Oregon Health Plan.
Yes, that's why they are involved, and we're operating under what's called a federal waiver right now because we have an Oregon Health Plan, which is different than how the feds say you have to, provide services to these low-income individuals. So we have that. Those costs are skyrocketing. They're going up 6 to 8% every time, every biennium, and that we can't sustain that. Mm-hmm. What we decided to do is change how we provide the services to those low-income people and bring it down to the community level where private providers will be providing services, but they will be putting their brains together, coming up with ways of serving their community that will save money, give them the outcomes they need, because they're not getting a whole big pot of money. I mean, they're getting all the money at once, but they're getting $40 million less than they would have, had we just continued doing what we were doing. And
so under the umbrella of this is low-income Oregon Health Care Plan.
Oregon Health Plan. That is it. Eventually, and there is talk
and Medicare.
Of maybe, Medicare is the federal, elderly, well, not even elderly.
Uh-huh.
I don't consider 65 elderly, but, 65 and above, you're eligible for Medicare, mm-hmm. and I don't know all the ins and outs on that either. And I don't want to get into that, but we're not Medicare people, so we're not there yet. Uh-huh. And that's for everybody. And that low income, high income doesn't matter. You get enrolled in Medicare. End of story. And but this is talking about Medicaid, where okay. It's low income folks, Medicaid, and those are the people that right now are served through the Oregon Health Plan. And
are those the only two groups, the Medicaid and the younger people who are under the Oregon Health Plan?
That are served by this. The people that be served by this would just be the Medicaid. Medicare is something different.
Yeah.
There are people who are what they call dual eligible. They're eligible for both. They're older, and they also are low income. And but then again, I mean, they get dragged into them. It's the Medicaid. Patients, customer, what do you want? Consumers that you would that we're talking about here, and that's the community care organizations. Right now, everything had been siloed, broken up, and then we'd be helping an individual with a mental or a substance abuse issue. Very often they're intertwined, I'm learning, and also physical, dental, mental. I mean, all those things were siloed, and there'd be a lot of duplication, and we were just spending an extraordinary amount of money to help people. And sometimes people don't take care of themselves. I mean, they just don't. And so this model will bring in some more, some patient accountability. And saying, well, yeah, you're still sick, and now you're in the emergency room, and you didn't take your medicine. So let's prevent them from, or keep it from getting to that point. The people who are managing this can say, this population, we need to have some people to go knock on their doors, say, hey, or call them up, whatever, contact them. Are you taking your medicine? Are you doing this? Are you doing that? Rather than paying this big hundreds of thousands of dollars in the emergency room when they get to a point where, they're needing life-saving measures where they could have been prevented. That's just an example.
So it connects the dots.
Right.
Simpler.
Right. And then, so when people talk about, so I'm going to be sharing information, your information is going to be shared with these other people that are caring for you, so they can figure out a better way to integrate it and spend the money better and get you the outcomes we need, rather than you going over here and then going over there and maybe somewhat maybe conflicting, who knows, with some of the diagnoses and all that. But the point is to bring in, rather than have the centralized system that we have right now, bring it down to the community level and let innovation take root. Right now, there is no such thing. There's nobody right now that would say, well, we're gonna pay for some people to go knock on a door and make sure that Joe is taking his medicine. There's no pay item for that. They're not going to do it. So what they're getting right now is, here's the money, you manage it, you take care of it, you're telling us how you're spending it. Let's see the outcomes. Let's see how these people are doing.
Who's managing that?
The community care. There's a board over this community care organization, and I don't remember how it's actually structured exactly off the top of my head, but
is it county or?
Yeah, they would be part of it. The Oregon Health Authority person would be sitting in. There's all the doctors that are part of this, that are providing care. So there'll be those people chosen. There'll be people from the community. There'll be people who actually.
Is it
they're
any
drawn from
doctor
all kinds
or
of different
just
places? No.
Specific doctors that the people have to go to?
No. There's just kind of like the insurance company right now, where any doctor that participates in, like Blue Cross Blue Shield, for instance, you can go to any of those doctors, right? And that's same with the community care organization. They're going to have providers that are participating in this to provide services.
Yeah.
And so,
yeah.
So I just thought a way of saving money, bringing in transparency and accountability, and breaking it down to the community level instead of the centralized bureaucracy that we have
state
right
level.
now.
Yeah. Is there any justification to the fear that the federal government will get involved, through the exchange and?
No, that's the other thing. The exchange, the health insurance exchange, that's
Obamacare.
That is absolutely a result of Obamacare.
Okay, which you voted no on that.
I absolutely did. And there's people saying, well, we need to have this. And the stated goals are, they sound rosy and great. And I hope it works out.
Yeah.
I hope it works out. We have it now, and the state decided to go through and make the health insurance exchange a public corporation that, quote, lives or dies on its own. Name me a public corporation in Oregon that has died. I mean, there's always some way that they can reach in and make sure that they live. I mean, they have that position. They're going, and it really concerns me.
Well, and I mean, let's take education. And I know that Republicans and conservatives and Democrats, they're all for education, and gee, so am I. But I'm for a voucher system. Actually, back in the olden days, when life was simpler, the government didn't even get involved in education, and government was smaller, and people had more money, and they were able to send their kids to, little homeschool. So
I think about somebody I had run into. Here was an 8th grade test for people about 100 years ago, or no, it was more than that. It was back in the 1800s, and some of the questions on there just were amazing to me. Maybe it was even 5th grade, but it was just so much more of a high standard was expected, and for students to know, it was amazing. Some of these questions, I'm thinking, wow, I don't even think I know that.
Wow.
Or I'm not even sure I would have known what they were asking, based on.
I've heard over the years that the education system have actually dumbed down, the tests and the students.
I can believe that. Look how we rank in the world now. I mean, if you were an enemy and you wanted to mess up a country, you'd do just what we did with education. I mean, I think we're doing a real disservice to our future.
There's
our
the talk
kids.
there, isn't there? Yeah. Yeah, and that's why it's so important to have a free society, a voucher system where
the money follows the kid. I mean, if you're going to have a free public education, I mean, let's set it up so it's not for the convenience of the
Yeah.
adults in the bureaucracy. That's what we have right now.
Yeah. And what
And
happens
focus on the kids.
is you guys love the kids, so you keep throwing money at the school system, which I'll tell you what, if I was in office, I would not give any money. I would say, let's do it right. Let's start a voucher system. Let's break the system that's already not working, so we can do something right now.
Yeah,
That's what I say.
You can say that all day.
But, yeah.
You have to take into account where we live and how
how people
likely that is.
think
But there are
and,
states
yeah.
that are embracing it
Is that right?
and going, and they are.
Wow. Well, I wish them luck. I hope
I
they
do
really
too.
well.
I do too.
Yeah. Well, anyway, I guess we were talking about how bad the medical care system could get, if
It's
it's in the
so
hands of the
expensive,
government. And
yeah.
so here we get to see a trial run. But the problem is with Obamacare, it's at the risk. First thing is I don't trust it.
Oh, gosh.
But-
nobody does.
Yeah.
I mean,
But it's
nobody
also the
does.
risk of people's lives. I mean, at least in education, if you wind up not being smart or be able to read, well, that's too bad, but at least you can still live and continue on with life. If
Right.
you wind up with a healthcare system that doesn't work and people die, well, that's terrible. That's something that you can't replace. You can't
Right.
replace somebody's life.
No,
So,
that's correct.